we've invited the incumbent and the challenger in a lot of key races in the area, and we're hoping that they will have great things to say to parents, providers in the community about early education and childcare issues. Candidates will be asked a series of questions by folks in the audience, and they'll be given 2 minutes to respond to the questions. I would like to thank the Lower Bucks Chamber for having us here today and for helping us host. And I will introduce Bill, who will be moderating the event.
So it's great pride that I introduce myself as the Executive Director of the Lower Bucks County Chamber of Commerce. And the reason why I say that is this is what we do. We bring our community together. Whether you're members or not members, we're about making sure people have the opportunity to be heard. So prior to doing this, I've been in public education for 36 years at all different levels, from phys ed teacher to high school principal, to K-12 principal, to superintendent. I understand the value of an early education, a quality program. Because somebody who comes in with a quality program, from a quality program, has a much stronger and richer vocabulary than somebody who doesn't. Which might not seem to be that big of a deal, but one of the leading indicators of graduating high school is being able to read at the 3rd grade level. So every person in my mind, every student, I believe, should come into kindergarten, 1st grade from a quality preschool education, early childhood education. That has a direct economic effect on their future. Okay? So a couple of things that I think are very fascinating, and I'm a little bit of the stat guy, so please bear with me. Last year, the PA Chamber of Business and Industry and the Pennsylvania Early Childhood Investment Commission, Early Learning Investment Commission, conducted a survey of over 300 employers, showing that the employers who lost employees, many were because of childcare. And think about this, this isn't just people who are minimum wage. These are 6-figure people who have to determine whether they stay in their job or they stay home because they can't afford childcare. The cost of childcare is astronomical. And finding quality childcare means you have to pay a higher price. And we want to make sure everybody has that. So there's a ongoing devastating workforce problem with childcare because we can't get childcare people who are employees and teachers to stay with the profession because it just doesn't pay well. Compared to your K-12 teachers, the pay is nowhere near that. And also the benefits aren't there. So this is a multifaceted problem that has economic and social implications that I thank all the candidate and the 2 representatives for taking their time to help you understand where we're going with this. There's all kind of staggering things here, 2.4 billion. Let me give you a real story. So one of them was the K-12 principal at Morrisville. A young man in 6th grade, we'll call him Joe, that's not his name. Sorry, Joe.
It's the most common name in the legislature.
Hey, that's why I came right there. He was crying in my office. And for 3 weeks crying, I'm like, what's going on? He goes, I can't get my homework done. I said, tell me, what's the issue? He said, right across the street from where is the elementary school. He had to walk across the street when school was over, get his sister from school, take her home, get her fed, do her homework, get her bathed, do all those things before he could do anything because his parents were working 2 jobs. That's the hidden cost of no child care. I said, look, Joe, here's what we're going to do for you. You have 6 period off. We're going to make sure you have a place for you to do your homework. And the next time he cried was in my office. So he was a senior, and he couldn't get into the Marines because of his back. So this is a huge issue. not just economic, but also it takes opportunities away from kids to participate in sports and do well academically. So I mentioned our candidates and our candidate and our legislators. I'd like to introduce them. Representing the House District 142 is Representative Hogan. Representing House District 18 is Representative Casey Tomlinson. The candidate for House District 142 is Anna Payne. So when we go through, there's going to be people asking questions who volunteered, aka drafted, who ask questions. Each candidate will have an opportunity to respond. There's no rebuttals, just 2 minutes to respond. We'll take turns who goes first, so everybody has an equal opportunity, and we have a timer somewhere. You'll everybody.
I got the reference.
Huh?
I got the reference.
All right.
Bill, I can do a timer.
Great, that's perfect, thank you. So Valerie, please introduce yourself, and first question, and we'll start with Kenny.
Hi, good evening. My name is Valerie Hamilton, and I'm the owner and operator of Children of God Educational Services. Thank you so much, candidates, for even taking the questions on. I appreciate that dearly. What are your views on the benefits or drawbacks of allocating additional state funds for high-quality early education?
Honestly, I don't see any drawbacks, right? We have to talk about investment in our future, and this is how we start. We start by investing in our children at young ages. We know statistically that 90% of their brain is developed between the ages of 1 and 5, right? So we have 5 years that we can really make an impact in that child's life. Despite this, too many people are missing out because we aren't investing enough. I believe we need to increase the state funding in early education programs. Long-term investments are undeniable, right? We heard the story of how this works, right? So we start by investing now, and it benefits the future of the whole Commonwealth, not just the district that we're in. So I think we need to start making these investments, make it a priority for our budget. It also benefits families. We heard the story of working families. I know friends of mine have trouble because of the cost of childcare, right? So this is a real life problem that's facing our community, and we need to make sure that we are stepping up and coming to the table with real solutions, and that's going to take dollars. So I know I will fight for increased investment in early education and childcare.
Thank you. Representative Hogan.
Thank you, and Valerie, thanks for the question. I've said before in the last 2 years at similar events about this topic that I view really childhood education as an economic development issue because businesses can't operate if families don't have these quality programs. My wife and I are expecting our first one any day now. She just went on maternity leave today, fortunately. And she works for a company that can provide a pretty generous package, but in a couple of months, we're going to be looking at what are our options, and we can't rely on family for all of that. So I agree with Anna. I don't think there's a drawback with additional funding for these programs, but what we have to do, and I see a lot of providers in the room, and some of the facilities that I've visited over the last 2 years or stopped by, we have to make it easier for you guys to stay in business. We have to make it easier for you to recruit, retain, and that's not a dollars and cents issue in Harrisburg, that's a regulatory issue. We've heard a lot of stories about the kinds of, I would say, nightmares that come down from Harrisburg and basically the hurdles that you're placed under to comply with this with very little notice in some cases. So we can make those investments, we can make those dollars and cents, but we also have to increase the supply. We have to make it easier for you to run your business, run your nonprofit organization, recruit and retain talented employees as well. Thank you.
I agree with both Joe and Anna. I see no drawbacks in providing that additional support, which is why I've consistently advocated for it. The research is clear that access to early childhood education gives kids a leg up both educationally and socially. I'm proud of the work that we've done these last few years. I've supported record funding in both the Wolf and Shapiro administration. In 2022 alone, we invested over $325 million in programs like Pre-K and Head Start. Obviously, there's still plenty to do, and I will always support those efforts.
Thank you. Charlene?
Hi, my name is Charlene Munoz. I live in Williamstown, but I grew up in Lower Bucks. High-quality childcare is not only educationally rich for the children that participate, but childcare is what keeps the economy good. Childcare system was already operating on razor-thin margins and is now facing a labor shortage. According to the IFO, the average childcare teacher in Pennsylvania only earns $15.15 per hour, while the wages of kindergarten teachers with similar credentials is $36.58 per hour. What are your ideas about how to adequately compensate and improve the retention of qualified professionals who educate children?
You get to start this one.
Me?
No.
No.
Joe, okay.
Well, you know, during the COVID era, there was a lot of additional funding for these types of programs to provide a bonus to that hourly wage as well. You can have state money that goes in to help with that at some point. But again, I think it's coming down to the supply issue. We've passed in the last 2 years, we've expanded the child care tax credit for families. We've created a new tax credit for businesses. So that's going to help with the affordability issue, but when you still have a lack of programs, when you still have demand that's through the roof like it is in Lower Bucks County especially. We're up 3 minutes from here, so it's nice to be back. But that is going to be a huge component of it, because as these business owners here and these nonprofits know that the cost of labor is going to continue to go up, and that cost is going to be transferred on to somebody else. It's going to be passed on to the family or to the parent that's trying to afford it. So we can find a balance with additional funding from the state to support it, but we also have to make it easier for these organizations to operate so that they're not hiring people just to essentially comply with regulatory mandates as well. So thank you.
Representative Tomlinson.
We absolutely must increase pay for workers in the child care system without a doubt. I would support legislation and funding to address this crisis because it not only supports our workers, but it supports our economy. There's just no doubt about that. Another issue I want to touch on is the burden of these endless requirements we put on child care workers. You know, we make them jump through all these hoops, and then the pay doesn't even cover the bills, let alone the debt that they've acquired jumping through those hoops. So we need to find a better balance there that ensures that we have quality educators, quality child care, and quality pay.
I mean, we can't expect to build a strong early childhood education system without adequately compensating people for that job, right? We're entrusting folks with our most precious commodity, our children, right? Our future here in Pennsylvania. And we need to make sure that we are adequately paying them and funding them. When we do that, we will actually have better workers too, because they're gonna have more training. They're gonna want to do the job. We're gonna be able to have more people who are gonna be able to send their children to childcare because you're gonna have more employees. So it's a win-win for the community by doing this. I would agree with Representative Hogan and Tomlinson in the fact that we need to make sure that we are funding this at a larger level at the state, but also increasing the benefits for workers as well, and making sure that they have adequate benefits.
So the follow-up question, and we'll start with Representative Tomlinson. You can say yes or no as your answer. Follow-up, do you believe that your early education teachers with a bachelor's degree should have paid parity with your K through 12 counterparts with the same degree?
Yes.
Yes.
Yes, yes.
All right, Anna, we'll start with you with this. Given the caps to domestic spending on early learning investment at the federal level, what role do you envision for state government in providing additional investments to pre-K and high-quality child care programs?
Yeah, so this means we have to make up the gap at the state level, right? This means increasing our investments in pre-K and child care programs, ensuring every child, regardless of their zip code, has access to these vital services. We also need to partner with our local governments, our businesses and our private sector and nonprofit sector to have an expanded partnership so we can all have wraparound services to come together and make sure that people can get the early education that they need. As a representative, I would fight for those things for you.
Representative Hogan.
Yeah, I think, I mean, we've talked about already about making up from the state level, the level of investment, but we can also create at the state level a environment that helps businesses to create their own programs as well. This is something I've talked about with a friend of mine that is a parent of now 2 young children, and she's a executive director for a chamber of commerce in Southeast Pennsylvania. She has to drive basically a half hour in one direction to drop off her children and then go in the opposite direction to go to work. So she's losing 2 hours a day just in transportation, and we're not even talking about the cost at that point. Now, there are employers that are looking at having certain types of facilities. They're looking at maybe moving some things in-house to make this affordable, make it available to their employees as a new benefit to their employees. And that's a regulatory environment that we could maybe help foster. We can make it a little bit easier to do that in Pennsylvania. So that's something that's, I think, is we started to look at this cycle, and I think next session we're going to be able to look at that a little bit more as well, to again help some of the larger employers or help smaller employers partner with existing programs to be able to provide some sort of benefit and give incentives to those businesses.
Representative Thomas.
We absolutely have to step up and fill in those gaps. As I mentioned before, the last few years that we have made record investments in early childhood education, and we've definitely made that a priority. I will continue to support those efforts with stakeholders and organizations like Children First so that we can better address these issues. Personally, I've seen many family, many friends who struggle. They're making that choice. Are we going to work? Are we staying home? You know, which also adds to the workforce issue as we all heard here today. You know, I think about years ago, my mom, who's here with us today, she was one of 7 kids, if you can imagine that. And my grandmom stayed home. My grandpapa was a Philadelphia cop. They were able to raise their family on 1 salary, 1 car. You know, that's just not feasible today. So finding that balance, filling those gaps, it's not only beneficial for families, workers, but also our economy.
Thank you. Deanna will read question 4. Diana, I'm sorry.
Diana Overton with the Sherman Kids Club. Many parents find themselves on long wait lists to receive high-quality childcare close to home. This prevents the children from obtaining the educational opportunities available at these high-quality programs. But it also prevents a full recovery of the economy due to some families having to stay home rather than work due to the high cost of childcare. What role is the state government in solving this issue? And we're starting.
Representative Hogan.
Yeah, it goes back, I think, in a large part to the regulatory environment and the access to it, because we're losing providers, we're losing retention. I mean, I was at an event sponsored by Children First a couple of months ago in Upper Southampton, where we were honoring employees that had been employed for their years of service. And that's a great thing to do, but that should be the norm. That shouldn't be the exception. So finding these ways, I mean, we had a story in Ben Salem, a friend of yours, Casey. It was a round table with various providers, and we were told a story about how a new directive came out on a Friday, and then they were randomly inspected on a Monday, and they were found to be in violation because they weren't in compliance with something that they didn't even literally have 24 business hours to address. And that's just not something that should ever happen. And again, we all want the best programs possible. We want safe environments. We want highly qualified educators and professionals in these spaces. But Harrisburg should be working with the providers. They should be making it easier to address this issue and not just overly penalizing. So that's one of the biggest roles in state, I think, in the state. And again, we've worked to make it more affordable, at least for the families. We've tried to create tax credits on both ends of the equation now. We've done that on the supply or the demand side. Now we have to help out on the supply side. We have to help out the providers.
Representative Thomas.
State government definitely plays a role through the budgetary process, there's no doubt about that, and continuing to make sure that we have the adequate funding is very important. That's something I have fought for and will continue to fight for. As I mentioned previously, it's not just a family issue, it's an economic issue. Personally, I watched my sister and my brother-in-law, both first responders, struggle to find childcare. You know, it's not even just the expense. They don't work the normal 9 to 5. And while I love to step in and help when I can, not every family has that option. So we definitely need to continue our work on this issue. On the flip side of that coin, I want to mention that, you know, I have heard from some of my local child care providers, some are here today, Representative Hogan and I sat down with a group of them not too long ago, and one of the big things that we heard about is that they spend a lot of time and manpower trying to meet all these requirements, meet all these regulations, when what they really want to be doing is caring for those kids, educating those kids. So again, finding that balance and also providing quality care is crucial.
Yeah.
I mean, state government plays a crucial role in addressing this crisis, right? As everybody is set up here, both for the benefit of the family, but also for the economy. I'm not, you know, alone up here, as we've all heard stories or have personal friends who had issues getting access to childcare because of the cost of the childcare versus the cost of their wages or the travel time, whatever it may be, right? It has become a challenge. So the long wait lists, the more we invest in these nonprofits, the childcare industry, the more people can come and bring their child there, right? So that will help solve the wait list issue. So that is something I look forward to helping work with in Harrisburg. You know, I think we need to increase funding for childcare subsidies, so families don't have to choose between quality care and their affordability. By investing in the workforce and raising the wages for childcare professionals, you know, it improves retention, right? And we talked about that. We want to improve retention. We want to keep employees there, and we want to have good employees working with our children. So I would fight for those policies as well.
Thank you. Valerie, you have question number 5.
Yes.
And Representative Tomlinson, we'll start with you.
Providers and parents have discussed the general uptick in the need for children to seek mental health support. Children have felt the adverse effects on their mental health. According to data from the Children's Hospital Association and Mott Children's Hospital National Report, more than 1 in 4 parents said that their child visited a mental health specialist, with nearly 60% of those reporting a visit within the past year. Which mental health supports are needed most in your district, and how will you work to increase access for families that need these supports for their young children?
Thank you, Valerie. Since I was elected, we've definitely made bigger steps in investing in mental health overall. But in this last budget, we invested over $100 million towards mental health in our schools. And I want to take a second to applaud the schools in my district. They have taken this issue very seriously and made it a top priority. I was elected during COVID, and the uptick in the need for these services has definitely grown without a doubt. So that $100 million is critical in meeting that challenge. I'm also the co-chair of the Bipartisan Mental Health Caucus. We meet regularly to talk about resources and solutions to make sure that all Pennsylvanians have access to mental health care.
So I work for the county, that's my day job, and I see mental health issues on the daily. It does not discriminate, age, gender, race, right? And we know this. And we need to be making more investments into our mental health and into our community groups, into our local mental health organizations, into even our local government, right? County mental health services. We need to make sure that we're funding it at the school level. So we have guidance counselors and social workers that can address these needs, right? We see it throughout our community, especially in the lower end of the county. So I would definitely be a proponent for somebody who's going to advocate for access to even more telehealth, right? We need to make sure that people can access telehealth. That's super important. And have access to mental health services, not just through the schools, but to make sure that these nonprofits that come in to join have the services and funding that they need to do the job.
Yeah, I want to echo my colleague's comments, Representative Tomlinson, about the additional funding, the additional $100 million for school funding for that. That doesn't necessarily trickle down to these earlier programs, unfortunately. But again, it's about improving the workforce. It's about making these resources more available. And we live in a fairly densely populated area of the Commonwealth of Pennsylvania, but in other parts It's just, frankly, it's just more sparse. You don't necessarily have access to these professionals. That's where the telemedicine could come in handy in a lot of those areas. I think, though, we should be having a conversation as well about what is driving up some of these the conversations in the first place. And obviously, you can point to the pandemic, and I think that impact of those lockdowns is going to be felt for a generation, if not longer. But T-minus 10 days until I'm a parent, but I've talked to enough to think that maybe social media is having an impact on this as well. And how do we as a culture and a society have those conversations and looking at the use of social media in schools and what that would look like. I know other states, I think California may have actually banned the use of cell phones in school now. I think I remember reading that. So we've put funding in the budget as well to have like lock boxes and bags now in classrooms if the school district wants to have a pilot program to put cell phones in there as well. Because I think we're all the same age. We didn't have cell phones in school, maybe late high school, but I think that's been a huge driving impact of it as well.
We had cell phones, you couldn't do much with them now.
Yeah.
Besides make a call.
Yeah, we used to pass notes back then. That was the way everybody. Thank you. Kathleen, what were your questions?
Hi, I'm Kathleen Carmona, I'm Executive Director of the Academy Kids Hub. Thank you for having me. Thank you for coming out, taking time. As you may know, evidence-based home visiting has positive, lifelong impacts for vulnerable families. With home visitation, parents and other primary caregivers receive consistent parenting education and assistance in medical care coordination. Home visitation also builds trusting relationships with families and promotes goal setting that helps to increase the number of positive family outcomes, including stable, safe home environments and understanding of children's growth and development. Currently, approximately 2% of all children under 6 and only 5% of low-income children under 6 are receiving these critical services. How will you support the expansion of state investment dollars to serve those in your district who can benefit from these type of home visiting?
Thank you. So these programs obviously provide an immediate benefit, but they also set up the foundation for lifelong success for children's development. So in our district, where many families are facing economic challenges, expanding state investment in home visits is crucial. I will advocate for increased funding to grow these services, focusing on reaching more low-income families in the district who can benefit from it. We need to build strong partnerships between the state agencies, healthcare providers, and community organizations, and we can ensure these families have access to the support that they need. You know, these investments pay off in the long run by making the investment in the child and the family to begin with. So.
And again, I mean, this whole issue of early childhood education, early childhood care is again, it's an economic development issue. And a parent, you know, about a year ago, I remember being at the Bucks County IU for a roundtable discussion about early intervention for children born with disabilities, and hearing stories of families that had this type of early intervention and the amount of progress it made, and basically being able to have a professional in the home at basically 3 months or younger in some cases, the impact it would have. A friend of mine had a son born with Down syndrome, and having the IU come in, having these professionals come in immediately to be able to give that child the best opportunity it possibly could in its own personal development, that is critical. And that makes it easier for the parents to focus on maybe the other children, to be able to advance in their career, do what is necessary for their own development, because they may make the choice, and that's perfectly fine, that they want to stay home and be the permanent caregiver in the home, but they may not be able to do that either. We have to figure out ways to make it easier, and if that comes down to more funding, then that's what it's going to take. I've said before that Pennsylvania should be putting families first. There's no surprise that Pennsylvania is facing a demographic crisis by the end of this decade. Our population is aging dramatically, and we're not having enough children to replace that, and we're not recruiting or retaining people to come to Pennsylvania and stay here. Our young people are leaving for greener pastures, and we're not not, I would say recruiting again, but we're not recruiting enough families to come here because I think we're lacking in a handful of programs and benefits that other nearby states have. So this is another one of those ones that I don't think any parent wants to have to receive these services and funds, but we need to make sure that we have the best people providing them and that they're available to as many families that need them as possible.
Yeah, home-based visits are critical to making sure that we are effective and our investments are working in this area. Every situation is different, but creating a bond with that family only enhances our ability to not only help, but make sure that they have the resources that they need. And by doing that, we're ensuring better outcomes, no doubt. I'm committed to working with professionals in this field so that we can better address the needs through the budget process. Like any budget, whether it be a family budget or a state budget, you can't fund everything. Cuts need to be made, but sacrifices definitely can't be made in this area for sure.
Thank you. Renita, you posted number 7.
Thank you. Good evening. Renita Johnson, Director and co-owner of the Child Guidance Center of Lower Bucks County. As of today, there are only 13 states plus the District of Columbia that have passed or implemented paid family and medical leave programs for when a new child arrives or a serious health crisis strikes that of yourself or a close loved one. 4 out of 6 of our neighboring states have robust paid family and medical leave policies. However, in Pennsylvania, 66% of workers, totaling about 3.5 million people, don't have access to paid leave. Parents we've spoken to have said that paid leave would give them the ability to bond with a new child and recover from childbirth without having to sacrifice their family's financial stability. Would you support paid leave legislation in Pennsylvania and why?
Representative Hogan.
Yeah, I think I was in this very same room about 5 months ago talking about paid family leave legislation, and there's competing bills in the House of Representatives, and really the discussion comes down to, is it going to be entirely paid for by the employee, or is it going to be split between the employer and the employee? And that's a conversation that we need to have. There was talk about the bill running in the House of Representatives. It hasn't ran yet. But I do think this is an important piece of legislation. I mean, as I said months ago, I grew up in a middle-class family. I had a mother that could be a stay-at-home mom for us, but that wasn't the case for everybody else, and certainly not the case for my wife and I now. We don't have the same type of support that prior generations did, and we hear that from a lot of our friends as well that are going through this process, and the amount of money that they're spending on these programs right now. So being able to give them a couple of months with a child or an illness, being able to do that. My father, it'll be a year in about a week that he passed away. We were lucky enough that between my brother, my sister, and I, that we could basically divide up the labor to take care of him in his final weeks of life. But again, not every family can do that. Not every situation is like that. So I think once individuals realize how this is going to be able to help them, how this is going to be able to help them navigate health crises and family medical crises, because it's going to happen to everybody, one way or the other, they're going to be in support of this program.
Representative Thomas.
Well, not only would I support it, but I actually introduced the bill. When I first got elected, I was drawn to this issue, became very passionate about it. I had the privilege and honor to serve with former Representative Wendy Thomas, and she was such a champion on this issue, advocated for it like nobody else could. So when I realized that she was retiring, I knew that somebody needed to pick up that torch and try and get this bill over the finish line. Obviously, the goal of this is to make sure that if you don't have paid family leave, if you don't have maternity leave, you have that option, while also making sure that that burden isn't all on small businesses. So again, this is a bipartisan issue. Representative Hogan and I lead this issue within our caucus. Senator Robinson has a bill that's come out of committee. Representative Dan Miller has a bill that's come out of committee. We have yet to been able to take a floor vote on that. I think we came close, I believe it was last June. But again, I will continue to advocate for this issue and fight for this bill regardless of whose name's on it.
So yes, I wholeheartedly support paid family medical leave. As somebody who lives with cystic fibrosis, which is a rare genetic disease, when I was born in 1987, If there wasn't paid family medical leave now, there definitely wasn't any then. My mom had to decide to quit her job, to stay home and basically take care of me full time. Luckily, my dad worked a union job. We had good health care benefits, and we were able to do that. But I know what it's like, personally, to have to take off of work, to take care of yourself, and not get paid. I know what it's like to wonder how those bills are going to get paid. And you have no choice but to not go to work, or go back to work too early because you need to pay your bills, and then you end up getting sick again, and the cycle starts all over. So this is something I am extremely passionate about because I understand it personally, and I know too many people who this impacts. People not just with children, obviously, but that is an important aspect of this. But this is so much bigger than that. This is about being able to take care of a loved one when they're sick and not have to worry about how you're going to put food on the table. To be able to bond with your child, with your newborn, and wonder, well, am I going to be able to buy formula? We shouldn't have to make those decisions. It's 2024. We should do better, and we deserve better, and I will fight for better.
Thank you. Arnita, you did such a great job asking question number 7. You get to ask question number 8.
Okay. We want to close out by returning to the workforce and the economy. We know that many businesses are facing a labor shortage. Childcare access, transportation access, and food and housing security all impact an individual's ability to perform as a reliable employee. They all can contribute to staffing shortages that employers experience, or do we, both in and outside the early learning sector. In addition to making childcare more accessible and affordable, what other policies would you champion to help businesses facing a workforce shortage?
Representative Tomlinson.
All right, I got a long list here. Since I was elected, we've done a lot to address the burdens on family and businesses. We've increased the child care tax credit, which you've heard today. We've increased the property tax and rent rebate program. We've funded education at record levels, including $30 million more in career and technical schools. We've voted to increase the minimum wage. We've supported mass transit and infrastructure, increased fare funding, which supports many nonprofits who in turn support the needs within our community. We've worked towards cutting back red tape and regulation. These are all things that I have done. These are all things that I have supported. My goal has always been to do what's right for my community, regardless of the politics. It's unfortunate that my opponent didn't show up today, but I will always show up for my district. I'm proud of the record I have on delivering for working families. I'm proud of the diverse base of support that I've been able to gain, from labor to teachers to police officers to nurses to small businesses. You know, these are the people that make up the fabrics of our community. These are the people that I fight for in the legislature every day, and I hope to be able to continue that fight.
Thank you. Hannah?
Sure, so obviously we need to talk about public transportation, right? People need to be able to access public transportation in a way that they can get to and from where their job, or their doctor's appointment, or wherever it is they need to go. So we need to make sure we have robust public transportation in Bucks County, in not just the lower end, but across Bucks County. I have been an advocate for affordable, attainable housing as a supervisor in Middletown Township. So I would continue to be an advocate for that at the state level. We know that the housing is an issue, and that creates other issues. Not just people can't get into houses, but if they can't get into houses, then they can't get jobs. It's a whole full circle thing, and it prevents people from being able to work consistently and even find jobs in the first place. And finally, we have some pretty great things here in Bucks County. We have a tech school here, we have the community college, which has great programs now for training for skilled labor. We need to make sure we are utilizing those resources and making investments in workforce training programs to help make sure we are prepared for the jobs for the future in healthcare, in the trades, and in businesses, so we have the skilled workers ready when we need them. I know in Middletown we're going to be looking for people soon, in our Public Works Department, and we already know it's gonna be a challenge. So we're gonna start talking to the community college. We're gonna start talking to the tech school to see what kind of partnerships we can get and training, so that we're, when we're ready to hire, there's people ready to take those jobs. Thank you.
Representative Hogan.
Yeah, I'd like to echo some of the comments from both speakers previously. With the tech school specifically, Lower Bucks County Technical High School basically had to turn away over 300 kids last year, and it's a capacity problem. Now they're looking at expanding capacity. We're going to try to help any way we can at the state level and hopefully at the federal level with our congressman who can bring some money to make that expansion. But that's a huge problem right now because there are children that want to enter into the workforce. They want to enter into these programs. We're trying to make it easier in Harrisburg to make so that career and tech ed educators can leave, retire from the industry and become these educators. I was talking to a friend of mine that owns plumbing and HVAC companies yesterday. I said, if he's in his 60s, do you want to walk away from your business to teach high schoolers, the same school you graduated from, but then you have to spend the next potentially 3 to 10 years of your life getting certified to teach? He just laughed in my face. He wasn't going to do that, but he's built his own business. He's trained dozens and dozens of employees over 50 years or 40 years. So career and tech ed is a huge part of it. We've also, just rattling off some things that we've done in Harrisburg, we try to make it easier for people to become teachers. My niece is a public school teacher in Philadelphia. We've provided in last year's budget, we didn't do it this year, but a $10,000 stipend for student teachers because they're not paid during that time that they are required by Pennsylvania law to be in the classroom and teach. So we're trying to make it a little bit easier for that. We're working on legislation, Representative Marcel and Senator Frank Ferry, to allow community colleges to have some of this credentialing authority or at least be able to implement these programs, specifically nursing right now. It should be easier to become a nurse in Pennsylvania. That's a very in-demand profession right now. It's a critical profession that we have unnecessary barriers for as well. And as both individuals have said now, mass transit is a huge part of it. I stood with Governor Shapiro back in May when he came to Langhorne talking about the importance of mass transit. We are at a huge nexus in Lower Bucks County between the Turnpike, I-95, Deepwater Port on the Delaware River, freight, passenger rail. We need that capacity. We need that public transportation so that workers can get home or they can get to their place of business as well. And if we do not address that, and we are basically out of legislative days now in Harrisburg, SEPTA is going to face dire consequences and it's going to have downstream effects for the entire region.
Thank you. Before we get to your closing remarks, and we'll start with you, one of our attendees couldn't make it today. He sent a statement which I will read. It is from candidate Anand Patel, who was running for the 18th House District. Our state's education budget is woefully unequal to the task of providing high quality early education for our students. Early education lays critical groundwork that supports our children long into their educational futures. Towns and local communities cannot bear the weight of adequate pay for caregivers alone. Harrisburg must step in and fill the gap. Additional money from the state not only alleviates inequalities between poor and affluent students, it also allows local communities to lower the property taxes and put more money in the pockets of working families. In my hometown of Bensalem, the Minnesota state support for education necessitates high property taxes to keep our teachers adequately paid. The taxes are very unpopular. I've occasionally, and without knowledge of my redoubtable opponent, I don't know if I said that correctly, I am sure been attacked for voting to raise property taxes while I was on the Bensalem School Board. I have no desire to shy away from my record. I voted to keep our teachers paid, our schools open, and furnish our children with the early learning opportunities they deserve. The fact is that without a structural increase in state support for local education, property taxes will continue to rise as communities like Bensalem face horrible catch-22 compromise. early education or make life less affordable for working families. As a representative, I will fight for a substantial increase in state support for education, paid for out of substantial surplus. I will also back bills that subsidize childcare, expand paid family leave, and furnish early learning opportunities for children from low-income families. In addition to Mr. Patel not being here, there was also 2 members who are candidates for the House 144 district, Brian Monroe and Dan McPhillips, but neither of them could attend. So thank you for being here with your closing statements, and please go first.
Sure. I just want to say thank you for having me. Thank you for hosting this super important event. And mainly, thank you for the work that you're doing in our communities. It really makes a difference, and it's going to make Pennsylvania a better state and have a stronger future. So I'm just very grateful to be here, so thank you.
Thank you.
Yeah, I want to, well, again, thank you all for being here. Thank you, children, for organizing this event in the first place. It's important we have these conversations. I'm just going to end, today I saw a tweet that I thought was interesting and relevant, and it was, for the first time ever, we are investing $11 billion in K-12 public education, $1.1 billion more than last year. Last year was historic funding. This is even more historic. So this means more teachers in smaller class sizes, improved school infrastructure, and more mental health resources for our kids. Pennsylvania may be the only state in the nation with a divided legislature, but we can still come together to give our kids the tools they need to succeed. That was at 10:29 this morning by Governor Josh Shapiro. And we were able to deliver that in large part because people like myself and Casey Tomlinson are putting our districts first. We represent very diverse communities. We very much a 50-50 community in a lot of different ways, and we are open to listening to anybody. I've said this before, and it's not mine, it was my former employer, Mike Fitzpatrick, but no party has a monopoly on a good idea. So I am open to any type of conversation. I've proven, I think, in Harrisburg that I am one of the most independent members, not just of the State House, but of the entire General Assembly, in terms of doing what I think is best for the community that I represent. So I hope to be able to continue to do that. I'm looking forward to what the next 2 years can bring. Hopefully we can actually get some of these things done instead of just talking about it. But again, thank you all for coming out and spending time listening to us talk tonight.
Well, again, thank you to Children First. We really appreciate the opportunity. Unlike my opponent, I actually went to the Bensalem School District. I work very, very hard, as Joe just mentioned a few points, to make sure that those schools are funded. I went through them. They are part of the reason why I'm sitting here today. So with that, I'll just say it's been an honor and a privilege to represent the 18th District. I love my job. I love serving my community. I was born and raised in my district. These people aren't just my constituents. They're my family. They're my friends. They're my neighbors. I can't thank them enough for putting their trust in me, and I will continue to show up. I will continue to work hard so that they continue to have that trust in me, and I will continue to work to earn their support. Again, thank you for the opportunity, and don't forget to get out and vote November 5th, guys.
A couple things, and Senator Hogue, you mentioned it. Pennsylvania, this is a couple years old, ranks 45th in funding for K-12 schools. And one of the reasons why the change had some districts actually took the state to court and won, and good for them. Because your zip code shouldn't determine the quality of your education. You should be able to get great education in the Commonwealth of Pennsylvania, because it's a great place to live and work. 2 points about family leave. My niece, who was about to have a child, left a job in Pennsylvania to go to New Jersey so she could have the paid leave. We're better than that. We're much better than that. And I love everybody up here. The word that really just touches my heart is bipartisan. It's time. It's really time. And it was interesting, your choice of words. Bucks County candidate conversation. Why is it that only people like these leaders can have a conversation and not once did they mean each other? This is what we are, this is who we are, and thank you for being that way.